Caffeine can be found in a variety of different places. Some is well known as a cup of coffee, and others are a little bit harder to find. Pain relievers like Excedrin and Advil can contain upwards of 300 milligrams of caffeine. Now, these medications can often be taken to relieve headaches, backaches, joint pain. And then there's sodas and soft drinks, another common place to find caffeine. Brands like Coca-Cola and Mountain Dew can contain levels of up to 41 milligrams of caffeine per can. Breath fresheners, ice cream, and decaf coffees are not usually known for taking and containing caffeine, but can contain as much as a caffeine soft drink. Weight loss pills are also a common use to rev up the metabolism, containing upwards of 1,000 plus milligrams of caffeine. In certain weight loss tablets, caffeine levels can be equivalent to drinking up to 12 cups of coffee. Taking too many of these pills can be highly dangerous, causing rapid heart rate, shakes, and panic attacks. Now, a healthier form of caffeine can be found in green tea. Green tea has been known for its health benefits, such as reducing risk of disease, weight loss, improving quality of life. So now that we've discussed what contains caffeine and where it can be found, we'll now look into what kinds of effects it has on the human body. Now, there are a variety of positive and negative impacts caffeine has on the human body. Positive effects associated with caffeine intake can include increased energy levels, weight loss, and even athletic performance. Studies have shown that reasonable doses of 20 to 200 milligrams of caffeine can amplify well-being, awareness, and even happiness. Studies have also shown that any increase in the amount of over 200 milligrams can create adverse effects, such as panic attacks and anxiety. Caffeine also has the ability to improve function in the lungs. The Chicago Daily Herald reported that caffeine has been used as a tool to assist the breathing of premature new babies. However, the negative effects of caffeine do outweigh the positive. The overconsumption of caffeine has been linked to dehydration, insomnia, acid reflux, just to name a few. Coffee can be very highly acidic. Because caffeine can stimulate acid, individuals who suffer from acid reflux are advised to stay away from caffeine in the coffee form. Studies have also found that caffeine can negatively interfere with sleeping patterns, which can result in decreased energy levels, drowsiness, and depression. Being a sufferer of anxiety myself, caffeine is something that I choose to stay away from. Caffeine often triggers apprehension and alarm, which causes unnecessary panic attacks and jitteriness. It can stimulate nervous thoughts and cause an individual to feel extremely uncomfortable. It is important to know the many ways that caffeine can affect the body. So now that we have learned about the negative and positive reactions individuals can possess, let's find out how these responses can affect our bodies in the future. Now, caffeine intake affects each individual differently, causing long-term effects in the body. As we've discussed earlier, there are many impacts caffeine can have on the body. Studies have shown that higher doses put individuals at a risk of creating negative effects on the body. These effects can lead to serious implications, such as disease, caffeine abuse, and even overdose. The Illinois Poison Control Center reported 265 caffeine overdoses in just a 3-year period, which ended in the year 2004. Officials from the Poison Control Center also said that 13% ingested the caffeine in the form of the diet pill, while 14% just consumed it through energy drinks. Often, long-term effects include stomach issues, increased heart rate, and addiction. So today, we've looked at what caffeine is and where it is found. We've also learned about the many impacts caffeine has on the body, negative and positive, and we've discovered how these impacts can affect the body long term. Determining that caffeine is a powerful ingredient that has the potential to cause cause both positive and negative effects on each individual, we've concluded with too much caffeine consumption, the human body reacts unfavorably. While there are benefits to drinking it, including increased athletic performance or a boost in mood, the bad can outweigh the good. Studies have also shown links to bad cholesterol, dehydration, and acid reflux. In many cases, it does take a lethal dose of 5 grams to upset heart rhythms, but 1 to 1,000 milligrams can cause severe symptoms, stated by Dr. Gerald Lincoln of Everston Northwestern Healthcare Omega, the director of medical toxicology. But with each person comes a unique reaction to caffeine and its side effects. When individuals begin to educate themselves on the anatomy of an Americano or the potential reactions from a Red Bull, society will increase its knowledge on how dangerous caffeine can be, raising awareness for the potential action against overconsumption. Until then, many Americans will continue to wake up to the delectable smells of their morning mocha with chocolate drizzle and an extra shot of whip, neglecting to inquire what they are ingesting and why it may lead to a life of depresso rather than more cups of espresso.